To talk about this whole business with Senate Republican Conference Chair, Tennessee Senator Lamar Alexander. Mr. Alexander, welcome back to the program. Sorry for the technical glitches.
Thanks
welcome
for
to Live
me,
TV, sir. Let me just get your thoughts on these new Congressional Budget Office estimates, $849 billion, and they're actually going to have a savings of $127 billion in the deficit. I don't know what it looks like. I heard your colleague on this program, Senator Judd Gregg of New Hampshire, a budget expert. He told me this package is going to spend $3 trillion between now and 2025. What are you thinking, sir?
Well, of course, we don't know yet, Larry. The first thing we need to do is read the bill, and we don't have the bill. Second thing we need to do is get a complete Congressional Budget Office estimate, and we don't have that yet. What you were talking about were preliminary estimates, and we have 8 Democratic senators that have written Senator Reid and said, we won't vote. We won't vote on the first vote to proceed to this bill until we have seen the bill and have a complete budget estimate, and it's been on the internet for 72 hours. So that's the first thing we need to do.
8 Democratic senators. That's a very big number. Just talk a little. I want to get to your thoughts. I know you gave a speech on the floor of the Senate today. Talk to us about procedure and process and timing, because this is a gigantic issue between the taxes and the bureaucratic takeover and the spending and the debt that's going to be accrued. A vote before the end of the year, in your judgment, sir?
Well, I'm not sure. I mean, we spent 4 weeks on the farm bill. We spent 7 or 8 weeks on an education bill, No Child Left Behind. We spent 9 weeks on an energy bill. So I would think we'd spend at least that much time on a bill to restructure 16% of the economy. But first we got to read it, we got to know what it costs. And why do we need to do that? Because all the other bills we've seen raise taxes, raise premiums, cut Medicare, transfer big costs to states. And not only do they cut Medicare, they take the savings from Medicare that they think will come, and they spend it on new programs. I mean, they don't spend grandma's Medicare cuts on grandma, they spend it on somebody else. And we need to find out, does this bill do that as well?
Senator Alexander, I read your floor speech. You've got 3 bullets, 3 important points that constitute a Republican counter-proposal. Could you very briefly, sir, outline them to us?
Well, they're actually more than that, but I will do it briefly. Instead of a big 2,000-page bill that costs $1 trillion, we would say this. Let's set a goal, reducing cost, go step by step. Number 1, small business health plans, so you can pool your resources and offer more insurance. Number 2, competition across state lines. Number 3, reduce junk lawsuits against doctors. Number 4, insurance exchanges. Number 5, prevention of emphasize prevention and wellness. Number 6 would be fraud and abuse and waste. That's 1 out of every $10 in Medicaid and 1 out of every $7 in Medicare. And what we say is, let's take those 6 steps, go step by step to cut costs, re-earn the trust of the American people in that way, and then we can take 6 more steps.
The Democrats talking to you all?
Well, sure, but they're not paying attention to us. You know, we know how to do bipartisan bills. We sit down, we take their ideas, they take ours, we put it together, and the country sees us working like that. Their basic attitude is, we won the election, we'll write the bill.
And what do you think about Mr. Gregg? He's very pessimistic. He says this thing's going to pass. He believes it'll pass. And in particular, and this is where I want to ask you, he says, yeah, there's a procedural vote coming up, 60 votes to get it for cloture, get it on the floor. Then it goes into conference. The House bill's going to be the dominant bill. That's the far left bill. And then that's going to come back to the floor of the Senate with a simple 51-vote majority. Now, this is where the big controversy is, as you know better than I. Is such a thing possible? The biggest governmental bill, the biggest governmental action, really socialism light for the American economy and the American public, to be passed with 51 votes, sir. Do you believe that's possible?
I do believe it's possible, and I believe it happens. It'll produce a minor revolution in this country, because when you pass a big complex bill like that, you want bipartisan support to reassure the country. I was a very young aide here in the Senate when Senator Dirksen and President Johnson worked on the Civil Rights Bill in 1968. Johnson had bigger Democratic majorities than President Obama has today, but he was smart enough to know that if it was written in Dirksen's office, the country would look up there and they'd say, okay, if both parties think this Civil Rights Bill is important, then we'll go along with it. They're not seeing that on the health care debate today.
This is not exactly the post-partisan presidency, is it?
No, it's not. And it's a disappointment because we know how to do bipartisan bills. We've done it in energy. We've done it in education. We can do it in health care.
Senator Alexander, you're very kind, sir. Thank you for coming on. I look forward to speaking to you some more as this process continues. Now, folks,
thanks for your time.
Let us go.